And a very pleasant good evening, everybody. Welcome in. Guess what it is tonight? It would be called, you know it, Titans Tuesday. We're happy to have you here. Do we have a lot to talk about tonight? Boy, do we ever. We have Dr. Damon Petty. He is a sports surgeon at Baptist Hospital here in town, St. Thomas Baptist Hospital. And boy, isn't it lucky we've got him tonight, because we certainly have a very, very important injury to talk about. That would be the injury to one quarterback named Vince Young. We'll talk to the good doctor here in just a moment. All right, let's wind out. Let's say hello to the good doctor. Doctor, good to have you here. This is not your first time, so you're kind of an old guest here. We're happy to have you.
It's a pleasure to be here with you, Hope.
Happy to have you here, sir. So, you are here now to roll back the horizons of ignorance as far as MCL sprains are concerned. Give it to us now so that we can understand it. What's going on with Vince's leg and what's up?
Well, the MCL is the medial collateral ligament, and we've got a model here that will simplify this conversation.
Let's see, right where the red light is.
All right. This is a right knee, and when Vince got his knee hurt, his knee twisted in such fashion as to gap open the inside half of it like this. He probably didn't gap it open very far, but just enough to stretch this ligament on the outside of the knee, called the medial collateral ligament. And usually they peel off of the femoral side on top here. Sometimes they peel off on the tibial side on the bottom. But basically the job of this ligament is to keep the knee aligned and keep it from doing this. Okay? So he's loosened that up just a little bit. And what he's going to need to do over the next couple of weeks is rehab very hard to do a few things. One is get the swelling and the soreness out of his knee. The other thing is to wake up the muscles so that they start working properly again, so he has good reflexes and good power across the knee. Doing that will give him back his athletic capability and also help prevent further injury.
So in the scenario of knee injuries, that we probably could say, Damon, that is maybe the best thing that could have happened to him?
I think he picked the right injury. Yeah. Absolutely. He'll get back quicker with this than with any other ligament injury I could think of.
Right. Now, what does that do to a guy psychologically? Or to anybody? Let's say you and I.
It's pretty scary. Yeah. You know, your whole career rides on your ability to run and move, and then all of a sudden here's your knee and it's injured. People deal with it differently. Different athletes will come back much quicker psychologically than others, but everybody will get through it. And that's when that's when it's a good time to have some help from your trainer, from the physical therapy staff down at the Titans. It's going to help them get over this.
Now, I know that you operate and deal with the public at large, so you're not confined just to athletes, although I'm sure in your practice you have dealt with high school, grade school, college, whatever it may be. The percentage of injuries in an athletic setting, are they normally all pretty much knees?
In an athletic setting, I think it's probably during football season you're going to get 50% knee injuries that you're going to come to the doctor for anyway. You're going to get a bunch of ankle sprains. You're going to get some shoulder dislocations, some finger fractures, elbow dislocations, and things like that. But yeah, knees are one of the most common injury they're going to come to the doctor for.
Dr. Damon Petty is here. Our injury report brought to us by Baptist Sports Medicine. Now, let's contrast that you just showed us a moment ago with the model. We're talking a sprained MCL with Vince Young as opposed to Tom Brady of the New England Patriots, who is out for the year.
Yeah, big disappointment there for a lot of people. Tom apparently has torn his anterior cruciate ligament.
All right, can you kind of demonstrate that for us as well? Or?
Yeah, the main difference between the medial collateral ligament, which is just under the skin here, and which can be supported, like, for instance, Vince will go back wearing a brace, something like this, to help support the ligament, to keep the knee from moving inappropriately side to side.
Right.
Tom has torn a ligament that's deep inside the knee. You'd have to flip the kneecap out of the way here on this model just to see it. And if you bend it, you'll see this little blue cord in the very deep aspect of the knee.
Right.
And the purpose of that ligament is to keep the lower knee bone from sliding forwards like this inappropriately.
Okay.
And when you tear your anterior cruciate ligament, a lot of times on the MRI that we get afterwards, you'll see where this bone here has banged into the upper knee bone and kind of maybe indented it just a little bit, and we get a bone bruise there. And people who have a chronically torn anterior cruciate will complain that their knee will buckle, right? You've heard that? And what's happening when their knee is buckling is this lower knee bone is actually sliding out from underneath the upper knee bone momentarily and jumping back into place. So we put that...
And that's the worst thing that could happen to an athlete.
I don't really think that's the worst thing at all.
Really? What is?
No. Well, neurovascular injury maybe? Like, how about what happened to Bo Jackson? That was pretty bad, too, where he got a very innocuous tackle by the Cincinnati Bengals playing for the Oakland Raiders years ago, and it ruined the blood supply to his hip, and he lost his hip over it.
Okay, so all right, I got you. I see.
Yeah.
All right.
We can fix this, no problem. Make it almost normal again.
but extensive rehab.
Absolutely. Yeah, I think so. I think
6, 8 months?
Well, what we see is that somebody like Tom Brady, who's going to have all the help in the world and all the dedication in the world to get better, he's going to feel like playing around 4 months after surgery, I bet. That's going to be a little premature, though, because we have a whole host of data that have come back now that say, hey, look, if you go back at 4 months, you're about 4 times more likely to re-tear than if you go back at 9 months. So he's probably going to wait a full year to go back.
When Vince Young comes back, whenever that is, 2 weeks, 3 weeks, 1 week, whatever it may be, what is it he needs to, in your opinion, Doctor, what is it he needs to be aware of, careful about? I mean, how can you really be careful if you're an athlete and you're out and you got 300-pound guys trying to tear your head off?
How you're ever going to be careful playing professional football.
I don't guess you can. But I mean, is there anything that he needs to do? Will he wear a knee brace?
He'll wear a brace.
I mean, on the field.
Yeah, I would absolutely have him wear a brace on the field.
Yeah.
We'll see what they decide to do.
Right.
Something like this, something that won't slow him down too much. The other thing he probably needs to do is get rehab to the point of confidence that he can just go on and play, not worry about it.
And oftentimes we hear that when an athlete is repaired surgically, and of course Vince is not going to be repaired surgically here, but just kind of this overall context, they often come back, or that knee, whichever one it is, often comes back even stronger than it was before.
Isn't that interesting? Yeah. If you have really good therapy, they can show you things about your body and train your body in such a way that it makes you an even better athlete despite your injury. I think that's the amazing part of that.
All of us old guys need to go back through that thing about once every month.
It would help, wouldn't it?
I'd love to have a completely new body, man. I don't know if it works that way, though. Yeah. In any event. All right, so the good news about Vince Young is he has a sprained MCL, and MCL stands for?
Medial collateral ligament.
Okay, and that Damon says, is probably the best thing that could have happened to him. And so that's what you're all about with Baptist Sports Medicine. You guys fix people up every day, sometimes several times a day, with different kinds of ailments. Doctor, thank you for being here, and thank you for bringing us up to date on everything that we needed to know about Vince Young tonight, and perhaps we'll see you again before the year's over.
That's my pleasure. Thank you so much.